Your smile acts as a silent signature in every meeting, conveying subtle messages to your audience without uttering a single word. Psychological evaluations consistently show that people with straight, white teeth are perceived by others as being more successful, intelligent, and trustworthy. Many people spend years covering their mouths when laughing or avoiding photos to hide dental flaws, which erodes confidence during sales meetings or first dates. This insecurity often persists because patients fear the pain of traditional procedures, the irreversible removal of healthy enamel, or ending up with paper-white results that look artificial. Modern digital smile design, or DSD, now integrates AI and 3D intraoral scanners to address these fears before any physical work begins. Traditional blind guess methods contrast with a predictive DSD loop. Using a 3D scanner, the dentist generates a virtual preview on a monitor. You see exactly how new shapes fit your face, moving forward with a pre-approved, anxiety-free outcome. Accessing this level of accuracy requires choosing a clinic that has replaced traditional, messy impression materials with these 3D digital diagnostic tools. Beyond the technology, you must select a material that fits your daily coffee consumption, your busy schedule, and your financial plan. Ultimately, achieving a natural-looking smile depends on selecting the right procedure for your specific lifestyle and long-term goals. This comparison matrix tracks the 3 primary paths for smile transformation: laser whitening, composite bonding, and porcelain veneers. Laser whitening is the fastest option. A dentist applies a peroxide-based gel activated by a laser in a single session lasting less than 1 hour. The outcome is purely a color shift of 1 to 4 shades lighter, though the physical shape remains the same. The trade-off is longevity. Results last 6 months to 2 years, and teeth are prone to color relapse from tea or coffee. Composite bonding involves sculpting a tooth-colored resin directly onto the tooth surface, usually requiring 0 to minimal shaving of your natural enamel. This method fixes chips and gaps in a single visit, providing both shape correction and a brighter color at a mid-tier price point. While lasting 5 to 7 years, the resin is porous. You will need periodic clinic polishing to prevent stains. Porcelain veneers are ultra-thin ceramic shells, requiring the removal of 0.3 to 0.5 millimeters of enamel. These shells provide glass-like stain resistance and high impact strength, with a lifespan typically ranging from 10 to 15 years. The primary trade-off is that this procedure is irreversible due to the enamel removal, and it carries the highest initial cost. Your choice depends on whether you prefer a lower upfront cost with more maintenance or a higher investment with long-term stability. A common misconception is that a Hollywood smile is a specific brand of veneer that you can simply buy. In practice, this result is achieved by applying different treatments to different zones of the mouth to create total symmetry. The dentist analyzes the lip line and facial structure to apply geometric proportions, often called the golden ratio, across the entire smile. For example, a gummy smile might be corrected with a diode laser to reshape the gum line before any work is done on the teeth. Similarly, back teeth might be brightened with simple whitening, while front teeth receive porcelain veneers to handle the most visible shape corrections. This combined approach requires much more comprehensive planning and a larger budget than choosing a single isolated treatment. A balanced aesthetic result is reached by targeting specific dental zones with the appropriate material, rather than using one method for everything. To decide which path fits you, follow this decision tree based on whether you need shape changes, how much coffee you drink, and your budget. If you need a fast timeline and have a limited budget, the tree routes you toward composite bonding. This path requires you to commit to a 5 to 7 year replacement cycle and more frequent professional cleanings to maintain the resin's appearance. If you drink coffee daily and want a decade or more of color stability, the tree leads to porcelain veneers. Choosing this route means accepting the permanent removal of a thin layer of enamel to accommodate the ceramic shells. Before starting any procedure, follow this final checklist to ensure the quality of the work. The first step is to treat any gum inflammation or decay. Adding cosmetic layers over a diseased foundation leads to premature failure and bad breath. Second, ask for a temporary DSD mock-up that you can physically wear. This lets you feel the tooth shape on your face before any drilling occurs. Third, select a shade that matches the whites of your eyes and your skin tone. Pure white shades often look out of place under natural lighting. The final step is to ask for the brand names of the ceramics or composites being used. High-quality materials from reputable global manufacturers offer better long-term durability. By matching these clinical steps to your specific habits, you can secure a predictable and high-quality outcome for your smile.